now move on to panel discussion 2, and we'll begin the session with a prelude by Dr. Dipti Mankar, professional development trainer, wellness coach and counselor, and she would dwell on an insight into mental health awareness of Indian seafarers.
Thank you. So I know we are over short the time, but I'll still try and curtail it as much as possible. So thank you, Captain Kamal, and thank you, Marik's team, for having me here today. So we are talking about mental health, and like the speaker just now did say, you have a dream. So yes, I too had a dream when I started off 13 years back for mental health. And at that time, like he rightly said, people said, we don't need another training for this. We have enough training for seafarers. But fortunately, today I feel, and I'm very happy to say, many companies today are doing a lot of work in this area, and tables have turned today. So this just shows that what started 13 years back today is seeing late but never. So moving on to, of course, I'm asked to do the prelude for this, and we are going to be having a very, very fruitful discussion post my presentation. So we are talking about mental health and well-being of seafarers. It's not working. Right. To start off with, yes, it is appalling that mental health is still not considered an essential concern to a great extent, which then manifests itself into extreme situations at sea. Like even Captain Basin had mentioned, there are so many other factors which are responsible, whether we are talking about mental health and physical health, and I also totally endorse both of them have to be referred to as health of seafarers and not segregating the two. The United Nations, this is a very interesting slide which I would like to share. So the United Nations Good Health and Wellbeing Sustainable Developmental Goals calls for 80% of the nations to integrate mental health into primary health care by 2030. And we are already in 2024, we have just started. However, WHO data published in 2021 showed that only 25% of nations had a system in place to do so. So today, as we dwell on so many topics about concerns in medical and in mental health area, this is definitely, it's like a time bomb, we have only this much time and you're supposed to do it. Let's see how far we go with that. Now, the Institution of Occupational Safety and Health is the world's chartered body for safety and health professionals. Now, in fact, when we were looking into why we are not having comparative data, in fact, I would like to thank Captain Tandon for this. And he had posed a question to me also, and which led me to work a little bit more extra. And but yes, definitely, we don't have much comparative data. And when they spoke about it, they came up with a report just last year that there is relatively very little empirical work relating to seafarers' mental health and how this compares with the general population. So this is seen being partly due to historical lack of interest in the topic itself. And they came up with 3 reasons for this. And they stated that firstly, seafarers are largely recruited on temporary voyage contracts, which was also highlighted in the previous panel, which were only awarded on successful completion of medical examination. So this tends to screen out unhealthy workers, leading to particularly a strong healthy worker effect, which cannot be adequately compensated for with use of appropriate reference groups. Secondly, they said that seafarers are a remote and dispersed group of workers who are extremely difficult to access. And thirdly, relatedly, it is very difficult to obtain a random sample of international seafarers employed by different organizations. Confidentiality is a major issue here, that should we share the data, should there be transparency? There's a very big question mark on that. So We started off with a survey, like even my earlier speaker mentioned, awareness is very, very essential. And the reason why the survey was taken up by myself and Dr. Radhika was my associate support in this, was because we found that through the trainings of psychological first aid and mental health awareness, whenever questions were asked to the participants, seafarers, they had very less understanding of mental health. In fact, there are so many who told that seafarers don't have mental health issues. But the data shows something else. So the whole purpose of conducting this survey was to find out what is the awareness level our seafarers are having. But again, let's not only pinpoint on seafarers here. It was very essential to get data even from the shore staff. Now the shore staff who are handling the issues and queries which are faced by seafarers, it was found most of them are not from seafaring background. And that's the reason why I wanted to also collect data from shore staff. And third, of course, from pre-sea cadets institutions, because they're the ones who are going to join vessels, they are going to be taking up this profession. So are they aware of what is mental health, what are the concerns? So as DG sir mentioned in the afternoon, yes, we had a very long meeting with him where we discussed the survey results, and we are going to take it forward according to the instructions given by DG. So the target sample, in fact this survey was endorsed by former DG Amitabh sir, and he had told me just one thing after we had a meeting: make sure I don't get a sample size of 500 or 800, Dipti, we need a good sample. So here at this forum I would like to thank all the companies and institutions who participated in this survey, which gave us a very good sample size of 2,530 who in all participated in the survey. Now the purpose of the study was to analyze awareness level, which I've already mentioned to you, but what was the focus? What are we going to do with this data which we have got? So it was thought over before we started this survey that we are going to build it up. So this was just the stepping stone, the first step. And if you see this particular pyramid here, the first was understanding and analyzing the awareness level. The next step was building awareness through workshop programs, which I have already been doing, and I'm going to actually have more data coming in a year's time to see the difference. And building a work environment with mental health sensitivity, which is extremely important. There were three main objectives of the study. First, of course, to have data from collective data from shore staff, seafarers and pre-sea cadets. Second, of course, to compare the awareness level between the engine and the deck. And third was to get data from pre-sea cadets, and of course to see male and female what is the awareness level. So what were some of the stats which I would like to share with you? Of course, the full report is already ready, which we will be circulating to all the companies, of course, who participated in the survey, and even otherwise it will be available. Anybody who wants the report can surely message and we'll definitely pass it on. So if you see the overall mental health awareness in the Indian maritime sector, you'll find that only 2% showed good level of awareness. So this is a very alarming situation. Because the point is, like they say, right, ignorance is bliss. If you're not aware of it, you don't know anything about it. But when you know that you are aware, you will definitely take some action to do something about it. So overall data, if you see, like it's clearly very, very evident here that 33% had very low level of awareness of mental health. Sorry, did I skip? Yeah. Then let's look into shore staff. The data which came in from the shore staff, relatively 5% showed good level of awareness, and again very low 26 and low was 37%. Again, not a very good stats if you may see. If you look into sailing staff, the seafarers here, only 1% showed good level of awareness of mental health. That what is mental health? Are they aware of the concept of mental health? What do they understand? And they were very basic questions in this questionnaire, right? In fact, some of you sitting here have already taken that questionnaire as well. So, moving on, the deck staff. Okay, of course there are a lot of comparators we can do in the study, But from the deck staff also we found that 23% showed very low level of awareness as far as mental health is concerned. If you look at the engine department, 17% showed very low, so they were better than the deck department, the engineers' awareness level, but overall it was poor only. Tandon sir is not very happy with this, but what to do, this is all statistically proven data, we have collected it. Yes, true, mind distracted, yes. And the ratings crew, in fact, we also collected data from the ratings, from the catering department also, electrical department also, but we put them into one category here. And unfortunately, no good level of awareness is found here, but definitely very, very low. In fact, just to share a quick thing, last year I've handled 4 cases of ETO suicides, ETOs and ABs jumping overboard. So sometimes I wonder why are the ratings more prone to such things, at least the ones I have come across. Finally, the pre-C cadets data also which came, only 1% showed good level of, and these are youth we are talking about. In fact, when I shared data individually with the institutions, because we have to maintain confidentiality, in fact the principals called me up and said, what can we do now about it? Because they were also really shocked with the awareness level being so poor, and we are talking about the youngsters here who are going to go out at sea. So we are in talks now to see how we can develop a module wherein it should not be a one-day affair for them, it should be an ongoing process. It cannot be a tick box activity, it is something which they need to practice, they need to be aware, and it should be a continuous process. So finally, paving the way ahead, what do I feel should be done, or even whatever studies I have gone through, we did a lot of review of literature as well. First thing, effective training in mental health awareness for seafarers as well as for shore staff. Professionals working with seafarers, okay? Because this is extremely important. In fact, I remember I had one sessions with shore staff people where I asked them very basic questions about ship and they were not able to answer. So I think you need to sensitize them first about how is life at sea. What do the seafarers face on daily basis? They need to understand, then they can empathize, which I feel is a very important skill which needs to be taught. How do you empathize? Even like Navjot said, compassion, so important. The way you talk, the dialogue you have, you can only connect with them if you're emotionally understanding what they're going through. Second, there needs to be a holistic approach to protecting seafarer, and of course when we talk about them, that safety is extremely crucial. So 2 important pillars to achieve this are to acknowledge the link between well-being and safety as well, and to provide structural support systems for the crew. And of course third, explore technological solutions such as telemedicine, which has been very beautifully put by Navjot. So these are 3 things which, when we are looking forward as to how can we take things ahead. So my concluding remarks for this, firstly, we need to understand that if mental health is no longer considered as a taboo, then seafarers will be more comfortable in seeking help, talking about their problems with their supervisors or their colleagues. And training can be beneficial in helping seafarers to recognize that a crewmate may be struggling, or also provide them with skills and confidence to start the conversation. So it's very important that they feel free to talk about it. And I personally feel the more we talk about it, we are normalizing those conversations rather than talking about it as mental health. In fact, I'm against the word mental itself. And every conference I tell, please, if somebody could think of another word instead of mental, then that will be a better thing to address it as. The minute the word comes in, the stigma starts, So first, of course, continue to improve seafarers' rights by continuing to lobby governments and work with IMO and other UN agencies. Secondly, we need to implement mental health interventions, which has started now. There are companies who are really doing good work, and we cannot say that they are not, but still I think it needs to be done collaboratively rather than in isolation. And we must also understand that when we are talking about developing policies and procedures on mental health, it cannot be done by a single individual. Everybody needs to get together to do this. So, we must deepen the value and commitment we give to mental health as individuals, communities and government, and match the value with more commitment, engagement and investment by all stakeholders across all sectors. And I think this is extremely important. Lastly, before I leave, because we are going to have a fantastic panel discussion now, this conference, when Captain Kamal had announced, I don't know how many of you remember this, it had happened on 14 September 2023 in a panel discussion which was talking about mental health and training in mental health, and a lot of concerns were spotted, and I was taking notes even at that time. So for our moderator and for all the panelists, to end, I will give you a recap of that because I think it will really set you in motion for the panel. So there were a lot of concerning questions which were raised by audiences at that point of time, which I had made note of. So first, of course, from perspective of how you elaborate on mental health concerns, and will there be transparency by companies in reporting incidences of mental health concerns. Also, what are the biggest challenges for well-being as far as officers and their families are concerned. PEMI is already discussed, I'll not touch that. But do you see a difference in illness and treatments for seafarers compared to other patient groups, which could include aviation and executives at various multinational companies as well as in the corporate sectors? And do you think through training and counseling, the seafarers would be able to fill the gap and help each other on board and in their daily lives? And of course, last but not the least, how should you navigate for a healthier tomorrow in order to make sure that all one concerns, and here we are talking about maritime sector, so let's not only catch hold on seafarers, we are also talking about mental health of shore staff people, which also went through a lot of turmoil, anxiety when COVID had stuck. So thank you so much for listening so patiently, and I hope that the panel now are going to have some great discussions, and of course a lot of questions invited for them. So thank you so much for listening. Thank you so much, Captain Kamal, for the opportunity. Thank you so much.
Thank you, Dr. Dipti, for sharing your valuable research insights. I hope it will pave way for more to do in mental health and well-being of seafarers. We now begin with a panel discussion that we all have been waiting patiently for. Mental health and well-being of seafarers, for which I would request the following panelists to please join us on stage. Captain Anshul Rajvanshi, Managing Director, Synergy Maritime Recruitment. We have on stage Captain Rajesh Tandon, CEO, FASMA, Foreign Owners Representative and Ship Manager Association. Dr. Jacob Matthew, Managing Director, Seabird Medicare. Ms. Sonal Ajmera, Nutritionist and Lifestyle Counselor, Evolve Wellness Clinic. Dr. Vinesh Chandramania, Consultant Psychiatrist. Ms. Divya Nair, Clinical Psychologist, Fleet Management Limited. And our lady moderator for today, Captain Mohan Naik, Managing Director, Dynacom Tankers Management Private Limited.
Good evening, ladies and gentlemen. At the outset, I would like to thank Captain Kamal Chadha and his team for this very, very unique conclave on mental health and well-being of seafarers. And already Dr. Deepti has pointed out that it's not only for seafarers that this is important, it's also equally important for shore staff. Before I came to this conference, I had spoken to Dr. Shetty, Harish Shetty, probably you have heard of him. He had handled some cases for us, including a long case of piracy, which happened 10 years ago, 11 years ago in our company. And I asked him a question which was actually came about because of the discussion with Rajesh, whether these cases are increasing on board and also ashore, and is there any comparison? So his answer was quite similar to what Ravajot has said, that yes, they are increasing, but they are not, it is increasing because of the number of ships have increased and the COVID and the post-COVID situation which arose. So what percentage he showed was 6%, what Ravajot spoke in his presentation. So that is equally true for shore also, for shipboard incidents also. So with this, I will straight away plunge into the panel discussion because we have paucity of time. So my first question is to Ms. Divya Nair. Actually, there are two questions. How can a company prevent or mitigate the chances of selecting candidates at the entry level who are not temperamentally fit for the rigors of sea life? Second one, after a traumatic incident on board, how does long distance counseling help to keep the morale of the seafarers on the ship on an even keel?
Thank you, sir. Hello, everyone. With regards to the first question, how can we mitigate and understand the temperament of seafarers who are about to be inducted into the occupation, right? So one thing, as a clinical psychologist and an in-house clinical psychologist at Fleet, we do conduct in-house psychometric assessments. Now, there are two layers to it. One, we can do psychometric assessments to rule out pathology, that is illnesses that a person may have, that is severe mental health issues. Also, if we rule out that, then we have the healthy population. And a lot of us, actually seafarers, are generally the healthy population. If you are severely mentally ill, you will not be able to hold any kind of occupation. What we are looking at, pre-existing issues or a tendency to develop a certain kind of illness if I put the seafarer under a stressful situation on board. So do psychometric assessments give you that data? They do. However, there are certain conditions to it. It needs to be administered in an appropriate manner. A psychometric assessment is just a tool that by itself holds less validity. It needs to be supported by a detailed background investigation. It needs to be also supported by a clinical examination by the psychologist. The psychometric assessment is a supplement to the clinical examination that the psychologist has made. Generally what I see is one sheet of paper with few scores written on it, and underneath that is written recommended, not recommended, and that's not how a psych report is meant to look like. It has a detailed history, it has certain recommendations, it has certain features that is highlighted. This person, although currently not having any active pathology, shows signs of, say, higher impulsivity. Because in his childhood also, he has a tendency to react quickly to situations. And if that is continued, probably in his childhood he had hyperactivity issues. Probably he had social connectivity issues. And if I put this person under a stressful environment at board, is he going to withdraw into himself? That could give rise to depression, anxiety, and other somatic issues. These are the things psychometric assessment will give you if done accurately. Now the downfall is that a lot of times, if physical health is all grey area, I think mental health is a swamp. There is so much of malpractice, there is so much of misinformation that completely confounds the entire history taking and the data that is given to us. So if we are able to do it properly, it gives you intense amount of data. The presentation and identification can clearly be done, and especially when it comes to severe mental health illnesses like schizophrenia, delusional disorder. Even if the patient is under medications, he or she, we can still find out certain symptoms, like a person with schizophrenia can have blunted effect, can have lower social connect, even if he or she is under medications. So these are things that we can find out under proper medical examination. So that's what we could do to understand where these issues can be avoided before we send them on board. But also, having said that, organizations have to take our recommendations very seriously. They can't rush and say, oh, we are short of people, let's just send him on a shorter contract, because that shorter contract also can be disastrous. Coming to the second question, does telecounseling help when it comes to trauma? Now, trauma is a very, very complex presentation. It has so many facets, and the way we understand, the brain understands trauma is different for different people. And trauma does not mean a major event has to happen, like an attack or a piracy event to be considered trauma. A death of a close one, or a divorce, or an illness of a child can also be traumatic for some people. Now, to keep up crew morale high, it's not just counseling that helps. The leadership really matters at that point in time. If you value crew over cargo, then that's your first step to higher morale. If your shore staff is able to connect to that seafarer, speak empathetically, understand issue, assure him at every opportunity that we are doing our best to help you, that helps crew morale. How does counseling help now? Counseling, basically, if there is some kind of traumatic incident that the person has experienced, my first instance as an in-house psychologist would be to understand what is the level of trauma the person is experiencing. Is he at risk to develop any other further medical concerns? Are there any other medical issues which is probably aggravating this trauma as well that he is experiencing? Once I understand the level of trauma, my need would be should I now, so like I said, everybody experiences trauma differently. Some may be in a fight mode, some may be in a flight mode, some may dissociate and do everything on autopilot. Where is he at? What are the techniques that I need to use to let out this trauma out of him? For some people, I could use relaxation exercises. For some people, talking would help. For some people, engaging with other people would help. For some people, it is so severe they are unable to function, in which case sign-off is recommended. But as long as I can see that he is on functioning levels, it's better for him to stay on board, but that would require the support of the rest of the crew. Educating them matters here, educating my shore staff matters, and a combined effort. So at my organization, we work as a team, we don't work in isolation. So that has really helped us bring down incidences of severe mental health outbreaks, and we have been able to reduce the number of sign-offs related to mental health issues because we worked as a team to address one simple issue. So this is how telecounseling can help in terms of trauma.
Thank you, Divya, for both the answers. They were really very insightful. My second question is, Dr. Vinesh, it's addressed to you. It's about cases of depression and anxiety on board. Because anxiety is one of the triggers which can actually trigger depression. So can this depression and anxiety be identified at an early stage on board? And once it is identified, what next steps should be taken?
Yeah, identifying any mental health issue, the first thing is the awareness, what previous speaker talked about. Second thing is acceptance. So now, once there is awareness, but acceptance regarding mental illness is very low in our society overall, not in a seafarer, but in a general population also. Because no one wants to label themselves as a mentally ill. How they are aware about the cardiac problems or hypertension or blood pressure or diabetes, anything, but they are not ready to accept the mental illness as per se. So the first and foremost is the thorough history, because in psychiatry we have diagnosed the case only with the history. We don't do any investigations, but only thorough history. If we are getting thorough history from the seafarer on board, and the sensitization and education about the mental health problems. What are the signs and symptoms? What are the early signs and symptoms of mental illness like anxiety or depression or other problems, so that The staff or the crew should be aware of the manager level also, they should be aware of the signs and symptoms of the illness so that they can recognize okay, these symptoms, particular seaman is facing these symptoms, so now what next? So after a diagnosis, there should be a telemedicine or through video consultation, we interview the client and we get to the root of the problem, the severity of the problem, and accordingly we decide upon the management. So first and foremost management is the reassurance. Reassurance is the first and foremost which can be provided on board. Second thing, if certain medicines are available on board, like we have certain medicines available for the physical illness, similarly for mental illness also very few medicines are available, some sleep medicines or something, it is available on board. But if we can increase the number of medicines for the psychological first aid, like if patient is in the acute panic, so only reassurance won't help him, only counseling won't help him. He will require certain medications so that his anxiety should subside immediately. So if we can include such medications, so on board we can provide the immediate help through the help of the medications. And whenever we are doing a psychometric analysis at pre-entry level, pre-C level, it only gives us the idea about the temperament or the particular personality traits of a candidate. But it doesn't, we cannot assume that this candidate will have a particular psychiatry problem or a particular illness in the future or on board. So it is just we are getting, if there is a gross psychological problem or psychiatric disorders like schizophrenia or delusional disorder or psychosis, definitely we can do something about it. But for anxiety and depression, if on board it is happening, so first the reassurance is there, and second, online counseling and detailed history taking will definitely help.
Thanks. That's where Mr. Rajat Kuman comes in for telemedicine. Dr. Ganesh, one more question in addition to this. Since you are dealing with the show-based employees also, and also probably in the schools and colleges, you find even in schools cases of anxiety, depression, especially during the exam time, this happening. Also, we have seen suicides happening in Kota, preparing for examination. So you find some similarity between what is happening ashore and what is happening on board?
Yeah, definitely there is a similarity. See, ultimately the main reason behind all these things is the stress. So how we are perceiving stress, because the stress tolerance is different for each and every individual. How we are perceiving the attitude towards the stress, our temperament, our personality, how is our coping mechanisms, all this decides whether he will go into any physical or any psychological problem. So definitely I am seeing lot of child patients referred from the school age of 10-12 years with depression and anxiety and other psychological health problems. We are also seeing nowadays lot of ADHD cases in children, like 7 to 8 years old child. They are very hyperactive, very impulsive, inattentive. So all these problems are definitely increasing, and now slowly the awareness after COVID particular regarding overall awareness of health has increased, not particularly mental health, but overall awareness of health has increased, and so the school are also identifying the cases at early stage and they are referring for the further management. So regarding depression and anxiety also, there is a quite similarity. The prevalence rate is almost same, but as the seafaring is a more dangerous and more stressful environment to work in, so the numbers are slowly they are increasing.
Thank you, doctor. It's a very nice answer. Why I asked you this question specifically, because we get a lot of signing off cases because the children of the seafarer is under depression. And he says his exam is there and he is not able to eat properly and he is having fever or something like that. So that is correlated. So seafarer is also affected by that. Okay. My next question is to Captain Rajesh Tandon, the most senior most person in the shipping industry right now on the dais. So Captain Rajesh.
Thank you.
There is a caveat to that. Yeah. So Captain Rajesh, you have been associated with IMEC as a chairman, and you have also been a managing director of a very large shipping company employing a lot of Indians, and you have had many cases of such type. But you know, in the MLC now there is something about bullying and harassment. And this bullying and harassment seems to be increasing, even though it's statutory, it is not allowed on board, it is banned on board. So what do you think, so many cases are coming to light where senior officers are bullying and harassing, and even gender harassment is there. So what do you think what is the reason for this, and how can companies mitigate this or prevent it?
Thank you for the question. I think it's a very topical subject that we are dealing with. Broadly, in my view, harassment and bullying can be classified into two broad categories. One is deliberate, which can be easily said as unwanted conduct, communication. It includes verbal, physical behavior, harassment based on factors like race, gender, religion, the position you hold, etc., etc. Now, such cases are easier to deal with than the second one, which I will dwell upon. It comes up to the company to take strict action once and for all, get rid of the guy, because there should be zero tolerance to any harassment or bullying which is deliberate in nature for any reason whatsoever. But the second one is more challenging, and I think it should excite or encourage the mental health or medical specialists over here. That is unintended or subconscious harassment, which occurs sometimes unknowingly when somebody behaves in a manner which is condescending in nature, without actually saying something or doing something. With your behavior or the way you treat somebody or you talk to somebody, that leads to stress and anxiety in the subordinate. How do you address that? And that is a question that I think we need to dwell upon a little longer. There are two ways of doing this. First of all, in my view, if we can identify that a senior is harassing his subordinate unknowingly, I think a certain amount of inbuilt briefing should be done at the time the person joins the ship, that when you are going on board, your junior subordinate is not as qualified, as experienced as you are. So don't try to expect him to be able to perform at your level. There is a mentoring role that every person on board the ship has to fulfill. And if you fulfill that and the person is able to perform his duties better, I think the stress levels amongst the juniors will go away. I can go on, I have a lot of examples that I've noted down, but in the interest of time, I will come straight to the second half of my comment here. Just like it is important for the senior officer to be mindful and sensitized towards dealing and addressing his juniors to be able to perform cohesively as a team, it is equally essential that subordinates understand and deal with the unintended harassment that they feel has been meted out to them. If the senior officer, for example, says, you don't even know how to correct charts. Hey, if that was your job, you should have known that job. And if he has pointed it out once, take time out and go and learn to do the correction properly, so that the next time around that the officer doesn't get a chance to say that. Similarly, in other cases as well, it is very convenient and misunderstood concept that I am being harassed. If a senior is trying to discipline you or encourage you with extra work which is required for the job, straight away the easiest thing is, I am being harassed. That's the straight away easy answer. And I see Deepthi nodding there, that's the kind of feedback you must be getting. The point here is that we all collectively, everyone in this room, whether it's the employers, the seafarers, the medical practitioners, have to work together to sensitize everybody. If you have been hired for a job, learn how to do it properly. Chances are the unintentional harassment and bullying will go down or will be reduced. If you are not able to do your job or you don't know something, communicate. Have an open and transparent communication within your team, and also the seniors have a duty of care towards their subordinates as a team to bring people together, give them a briefing, which is all there in the ISM code, is all there in our manuals, etc., how to carry out work on board. If we follow those things, I think the unwanted harassment and bullying cases, instances will come down and we will come to utopia one day. Thank you.
Just a rider to this question. Good answer, Rajesh. Nice but little diplomatic. My question to this more is, do you find the training that you got in the Rajendra or the Dufferin also contributed to you becoming a stronger person mentally? And the training that we are getting now, youngsters who are coming and getting fast promotions on board, and once some small thing happens and they say, what you rightly said, I've been bullied, I've been grabbed. But this was the norm of the day when we were trained. Today, when your children are growing up, you're not even allowed to touch them. They will go to the teacher and complain about you. So that is also bullying, harassment by the parent. So any take on that?
Yeah, I think I will hide behind the statement you made first, that I am the senior most person here. I still go by the same policy, spare the rod and spoil the child.
I see. So you support?
Second question about seniority, I'll answer. You are my senior.
Yes, in the good old days, we had a certain amount of what is today termed as ragging and will not be permitted at all. But in all honesty, the amount we learned from our seniors as part of the whole process, I think helped me in good stead and helped me through my entire career and continues to help me to today.
Correct. In 1975, ragging was officially banned because of some cases.
You guys joined the ship that time. You guys joined with us.
It happened in India because of India.
71st, officially permitted.
Okay. Thanks, Rajesh. Thank you very much.
Thank you.
Okay, my next question is to Captain Anshul Rajvanshi. Captain Anshul, in your vast experience in the mining industry, you must have come across several cases concerning mental health issues on board. Could you highlight a few of them and the steps that were taken in its aftermath to mitigate the occurrence and or prevent such cases from happening in the future?
Thank you, sir. And first of all, I would like to thank Kamal Chadha and Arek's team for organizing such a wonderful get-together of the maritime fraternity as well as maritime practitioners. I think this is the first time we have gathered together and discussing about PEMI as well as mental well-being of seafarers. Having worked for, fortunately or unfortunately, for manning for almost 22 years now, I have come across a lot of cases in different companies, but as far as I'll talk about Synergy, where I've been associated for last almost 9 years. There have been cases and there have been cases on rise because of maybe pressures on board or pressures from the families. So let me share some cases where we have gone through, seafarers have gone through mental illness and how we manage those cases, or where we do not manage those cases, so that we all can collaborate and see what are the best practices, how we can mitigate the risk what seafarers go through, and how we can stop any more fatalities on board because of mental illness. That is the whole idea. In around 2016, I don't remember the date exactly, we had a case where one officer had joined the ship, junior officer had joined the ship in Korea, and vessel was supposed to come towards Gulf. Just after the ship sailed out from the port, this guy came to the master's cabin that I would like to sign off from the ship. The captain said, "You've been waiting for almost 5 months as a fourth engineer or a junior engineer, but you want to go back." He said, "Sir, I want to sign off. Please arrange my sign off." So somehow masters and chief engineer convinced him that okay, next port is he'll be passing through Singapore. We'll arrange your sign off after almost 8 to 9 days. He was fine, and then after 2 days we got a message from the master that this guy is missing from the ship. Okay. So there was no other sign other than his sign of request. And then when we carried out some investigation, we came to know he was undergoing some issues at home regarding some family issues, or regarding his parent wanted him to get married to somebody else, and he wanted to marry with somebody else. What I'm trying to say, a small issue like this, or maybe it's an issue like this, can lead to this kind of consequences. Okay. I don't know how to prevent this because there was no early signs which any master could catch or engineer could catch that he was undergoing some pressure. Maybe they could not find, and we lost this young boy. In fact, around that time, one study was done by PRI Club that most of the suicides in maritime field, almost 80% of the suicides were done by junior officers or trainee ranks, which is, it is somewhere our responsibility to somehow train these guys to deal with this pressure. So this was one of the cases where we could not save this boy. And unfortunately, as far as we Indians are concerned, when we talk about mental illness, we only talk about the person has gone mad. So I think we should all accept that it's okay to not to be okay. In the previous panel discussion, we were discussing that a lot of seafarers are there which don't declare their illness. It can be diabetes, it can be BP, or it can be mental illness. But somehow, I think it's our collective responsibility to ensure this. That be truthful, you will get the ship. Even if you have gone through some mental illness, it is as good as having a BP tablet or as good as having a diabetes tablet. You can be perfectly alright if you have regular medicines, whatever illness you have. So I think if somebody is hiding these facts during pre-examination, pre-joining medical examination, it is somewhere we have failed collectively as an industry that to reassure our seafarers that it's fine not to be okay, it's fine to declare, we will take care of you. Okay, coming back, so after when we lost this boy in somewhere in 2016, we put our minds together in synergy, and then we tied up with a company called the Tata Institute of Social Sciences, and we launched a psychological helpline in 2017, which was inaugurated by then DG Shipping Malini Shankar. So this helpline was open to all the seafarers across the companies, and anybody could call these counselors. They were trained counselor to answer these calls. So it was called iCall. Okay. I'll come back to later on what we did with that. Coming back to one second case, one ship was on the way from to USA from Panama, and one of the officers on board started, young officer, behaving, showing some mental illness on board. I don't know what is the right term. It's called psychotic disorder, where you start showing signs of very high that you are the king on board, and suddenly you go to a very low, start crying on board. So, but when we contacted our psychiatrist, he said, don't worry. He checked the medical chest inventory. He said, start giving the medication to this boy, and to our good luck, after 4 days of proper medication, this boy was completely alright, and we managed to sign him up for Panama. So somehow we could manage to save this boy. Another ship during COVID time was on its way from South Africa towards the Gulf area. Again, signs of mental stress on board. This guy was saying that this guy is on board team they're talking about me behind my back. They are conspiring against me, and they will do something bad towards me. So again, luckily, we got in touch with our counselors and doctor. Again, medication was given to him, almost 5 days medication. And by the time ship reached Gulf, the onboard team, the master decided that this guy is perfectly alright, and there is no need to sign him off because of mental illness. And believe me, this guy completed his, I think, remaining 4 months on board, and he signed off on successful completion of contract. Okay, so another case which happened last year, one junior engineer went on board, he got married, and after 1 month of his marriage, he went on board. And after 3 days of his joining the ship, she was coming down towards Singapore. He started showing anxiety, and again some sort of stress. So initially master tried to counsel him, master said you stay with me in my cabin. Again this guy was saying, onboard team, onboard colleagues will kill me and all that. And first day master kept him in his cabin, second day when we were trying to contact through our counselors and doctor. The doctor, in fact doctor was on line with the master on the video call with this boy. He came to his master's cabin and then I don't know what went wrong with him. He ran away from the deck and in that stage he jumped from the higher deck to the main deck. And again we lost this boy. So what I'm trying to say, it's very, very important to find the right signs of mental illness. If we can reach out, we can contact the right, we can give him the access to counselor and doctors, and we can give him medication. Then most of these cases can be handled, and we can save these lives. I can go on, there are many examples where...
We'll come back to you, but first of all, I must thank you for those candid incidents that you have been so very nicely shared with everyone. You can learn a lot and try to stop such kind of incidents.
So the idea is to understand the earlier sign, what these seafarers are going through,
Correct.
and then reach out to them and whatever counselor help or medication, so that it can be treated properly.
Before I go on to Dr. Matthew, I think Divya wants to say a few words on this because she does.
I just wanted to add on to what sir was saying in terms of prevention and holistic prevention, because we've also had bad state of mental health amongst our crew a year before in 2022, and there were increased rate in suicides and other mental health issues. And one incident really affected us all, to the point where my shore staff was also deeply affected by our captain. And it honestly, there is no difference. Be it captain, be it a rating, mental health is same for everyone, right? And we all undergo different pressures. So that hit us so hard, and we used to do psychological first aid training only for the top 4. And when we realized if the top 4 struggle, who's going to help them? Who's going to escalate it? I didn't tell us that, oh, the captain is undergoing issues. How do I help the captain? And that's when we started doing first aid training for all rank and for ratings in person, where I do it in person so that it is easy for them to relate and understand. We also started training, same psychological first aid training across the shore staff, right from the leadership. Each and every person in our organization is made to understand what are the warning signs. Suicide always has warning signs. We have been thoroughly and repeatedly reinforcing this fact that there are always warning signs, and every statement of suicide has to be taken seriously. Even though a person may say it casually, I feel like dying, I feel pressurized, I feel helpless, sometimes it's all just, life is just like this. Perhaps if I go, everything will be fine. These are red flags. How do we identify the red flags? And because we started doing this, and we started encouraging people to talk about it, and we started reassuring that mental health is just like physical health. You can have a bad episode and bounce back as well. You can stay on board with medications and continue your contract. We will help you get back to fitness and get you back another vessel. Just sign off right now, get yourself fit and get yourself treated, and you may not have further issues. This reassurance coming from the leadership, this cohesive working environment that we were able to establish, led to absolutely no suicides in the last year. 0 instances, and that was very heartening, and we hope to continue that streak this year as well. But that has really helped, where we worked on multi-level and in a holistic environment.
Thank you, Ms. Divya. Now I go to Dr. Matthew. Dr. Matthew, this PME subject has been discussed threadbare in the first panel. But since you are not in the panel, I would like to ask your views on PME about 2 things. Specifically about 2 things. One is where the PME has been not done properly, declaration has been done. Okay, how does seaworld deal with it? And if there are any, if the seafarer is taking any medications for anxiety or depression, Is there any way you can find out in the pre-medical, which some part of it was answered? But I want to get your perspective on the fitness, whether to employ such a person under MLC or not. What is the MLC perspective on this?
I'll just answer these in two parts. The first question is that regarding mental health, most of the companies with whom we work, I give them advice, and they've all been most acceptable on doing a mental evaluation. So we do the psychological evaluation of most of the seafarers. Almost all the companies that we work with have been very open to doing a mental assessment. So we do the psychological assessment. Now earlier, people used to just do a perfunctory, a personality test, which is not adequate. So now we've gone into MMBI, MBQ, and if we find something positive, then we go in for a Rorschach's. But before that, we get back to the psychiatrist, we then ask him his opinion, and then take him on board when we do these tests. So we have not faced much issues on having the mental evaluation as part of the PA. Most of the companies have come around. Now, two aspects I must tell. Having been a seafaring doctor, I was a submariner. I sailed on board submarines for almost 20 years. And having been now working in the maritime industry for 24 years, the commercial side, the number of cases of mental illness has certainly increased in the last 44 years. I'm sure that when you or Captain Tandon was at sea, there were far less cases. But it does not mean that our seafarers have got more mental illness. It is the general population which has got more illness. So I think we are a much more resilient number of our seafarers are much more resilient than the normal population. And so the number of cases that we have is not different from the general population. So this is one thing that I must emphasize, that all our seafarers are good.
Dr. Bharti, since you discussed about me and Captain Tandon, in our time, the normal contract for senior officers used to be 9 months. But when there were no relievers, we could continue for 18 months, 19 months, 20 months, 22 months at a stretch. And I never faced any mental issues or physical issues those days. Maybe ship and environment was different, I don't know.
No, the stress levels are much more now. We have Dr. Vinishia, who has treated a lot of people who are on hijack ships, piracy. I mean, it was not there before.
So I faced mental issues on board, I can tell you that. So after 12 months on a SCI ship, I went with my leave application to my captain. Ship was in Bombay. I said, I want to go on leave. Why? I finished 12 months. He looked at me, looked at the application, told the application, and he used a profanity word which I can't repeat here. Go back on watch, continue working. So I was so stressed, I went and bashed the bulkhead, gave him 4 galleys, and went back on deck and started doing my duty, and completed 19 months on board the ship. So it's not that it was not there. We knew how to deal with it.
But it was much less. So that's one part. The second part was
MLC.
On the
MLC part.
On the MLC part. Now we must understand one thing. There are 3 types of assessments that we do when we do a mental checkup, a mental assessment. We have people who have got psychosis, people who got neurosis, and people who got a personality disorder. Now, if you, in your assessment, find that somebody has got a psychosis, which means schizophrenia, bipolar disease, paranoia, any of these type of illness, you are unfit. I'm sorry, we cannot take him on board. It is these cases which have a neurosis, which would be at a lower level, that we could still do some counseling, we could see a proper evaluation of the case and let them go. And again, personality disorders are if you have an attention deficiency or you got OCD or something like that, we can work around it. So it's not that they would be completely unfit. But again, I must emphasize, our MLC and our regulations are very, very clear. I just carried the points here with me so that somebody doesn't say that, these are all unknown grey areas. The regulations are very clear, and it is only interpretation which is not so clear. So if you can interpret the regulations which has been given by the MLC, we will not have any problems. And I can assure you that after average 10 to 12,000 people that we assess on a regular basis every year, I do not see even 0.5% failure in the testing.
Thank you.
So I think our regulations are very good. And we just have to follow them properly.
Now I turn to Ms. Sonal Ajmera, who is going to be speaking on the second part of the panel discussion, that is on wellness. And she has got something positive to say. We have been discussing some negative things so far. She is going to talk something positive.
Certainly. Thank you, Doctor.
Can I frame my question?
Yes.
In your practice, you have been meeting a large number of seafarers. What kind of medical conditions do you come across which are a health hazard for the seafarers, and how do you intervene and help them to deal with them better? First part. Second part, do you feel that the personnel in the ecosystem of the shipping industry would benefit from more information, training and counseling for various areas of wellness? You could guide us from the perspective of nutrition.
Sure. Thank you, Captain Nayak. And while I continue to thank Merex and Seabird for giving me this opportunity, I'll also take a quick moment and a privilege of this panel to thank a dynamic young entrepreneurial couple who I came across, and that is Mr. Bobby Matthews and Dr. Rebecca Matthews. They are the faces behind the World Wellness Center. I must tell you, I don't know about the financial logistics, but you guys are doing a great job. It's very satisfying when I see a happy, satisfied patient go home and say, look, I'm feeling better. And you've made that possible, so thank you very much. With that, I'll come back to Captain Nayak's question. Well, I think it is time to address the elephant in this room, by which I mean acknowledge, recognize, accept and act on the fact that you, me, the urban upwardly mobile population of India and the seafarers are just eating too much. There is a food pandemic. It's the gluttony of gluttony happening because there are food apps by the click of a hand where you can order your food. There are these social media sites which are making gourmet food look like each one of us should have it, and we are all there to become foodies. And what's the result of it? The result of it is seen in all of us. Let me on a lighter note tell you, we are all sitting here, such a lovely environment, lovely evening, there's snacks flowing, there's tea and coffees coming, there's a lovely dinner spread and drinks there. Do you know we're going to go home with 2,500 plus of calorie intake today, most of us? And believe me, that's more than what we are supposed to have in an entire 24-hour day. So what do we do? Well, this is exactly what's happening to all the seafarers. The top complaints or hazards that I come across are obesity, diabetics or pre-diabetics, and lifestyle-related fatty liver syndromes. And these are the complaints or these are the medical diagnoses with which they come to us. So what do I do then? Well, I analyze their lifestyle habits, I understand their food intake, I try to understand what myths they have about food, because everybody has myths about it, and I try to also understand how I can counsel them further so that firstly they can clear their misconceptions about various food groups. They read something on the social media, they think this is the way to do it, and they do a DIY. They do it themselves, and they do it wrong. Or they think that, by abstaining from something like this, we can do it. Or they think that, oh, maybe I can go fasting for 10 days and then come for my medicals, and I can then be correct on the BMI platform, and I'll become okay. So my job is to counsel them, make them aware of what their misconceptions are, gradually form a food regime for them, which fits into the foods which are available on the ship. And after that, help them in understanding behavior modification, because that's their approach to food, that's their approach to lifestyle. And after that, once they are off on the ship, there's a constant follow-up, a constant counseling and hand-holding, which then leads them maybe to a more successful situation medically and helps them deal with these chronic problems. So I think, the seafarers are dealing with it in their own best possible way, and so are all of you. And I think a nutritional intervention or an intervention for wellness can really help us there. I think coming to your second question about whether some kind of education, training can help the personnel at sea in the sea business, I surely think that would. Let me take an example of maybe your chief cook or your team of cooks who produce the food on your ships, and imagine making them aware and training them about the various food groups, the benefits of each group, how the combination of certain foods can be better absorbed nutritionally and create a more healthier combination. Maybe training them how they can make a more interesting meal on the ship for a vegetarian or maybe even a vegan seafarer, maybe somebody who's gluten intolerant or maybe somebody who's lactose intolerant. So training these people involved in the ecosystem of buying food products, creating food recipes, and serving them could really up the game there. Also for the personnel involved on the sea, maybe if they are trained on how to make better choices from the variety available on the ship, let them understand how reuse, recycle, and reproduce the leftover ingredients can lead to a better output, better bottom lines. I think all these areas of training would definitely help the personnel to look for a more healthier life ahead. So definitely that would be helpful.
But Mohan, don't you think that her comments just before dinner are a little scary for all of us as we proceed?
How many Zomato sales do you have?
Well, you could look into my dinner plate and I'll show you how you can do it in 400 calories at the ITC Grand Maratha.
Thanks, Roman. Thank you very much for your insight.
Yeah.
So, thank you each and every participant of this panel discussion. It has been very, very fruitful. And now we have about 14-13 minutes left. I will open the forum for questions and answers. Yes, please. Yes. Can we have the mic, please? Mic. We require 2 mics here.
Go first, ladies first. Rishika Chattopadhyay from Confident Shipping. Just to follow on Mrs. Ajmera's wellness program, I think what we've missed out here as a community is meditation and yoga. I think there's big traction here seen in other industries, and there is a lot of research done on that. I don't know if I missed it earlier in the day, but this is something that perhaps we could incorporate and have, like even training of trainers of yoga teachers or meditation, whether it be I don't know if anyone's aware of pranayam techniques like the Sudarshan Kriya and stress reduction. So that in itself is sort of a healthful pill to begin with, and so on and so forth.
Some part of it was dealt with in the first panel discussion, and they have actually pointed out how yoga can be more helpful in dealing with mental stress on board. Captain Basit sitting here was a big proponent of yoga on board ships.
Yes, Captain Naik, it was mentioned in the first session. And not only I spoke about it, DG Shipping himself said Sagar mein yog. So it has been, and in GMIS function recently, this was inaugurated in a big way, Sagar mein yog. Thank you.
Thanks, Ishita.
Thank you very much. I have Mrs. Ajmera made a remark about diet on board. One of the most challenging things on board is to tell a seafarer what he can eat and not eat. Because he's there on board and he has to have 3 square meals. And his response typically is, खुद तो स्विगी से ऑर्डर करके खाता है, मुझे क्यों बता रहा है? And there's nothing wrong in that probably. But wherever you have this, you mentioned lactose intolerance, dislikes, likes, allergies, etc. How would you tell your seafarer who is joining on board that all these issues are to be handled by him and not by the cook or the other management on board? That if he doesn't like bhindi, then he has to find a solution and not the cook finding a solution for him. How would you handle that part? You're not allowed to go and get the galley anymore, sir. Ask them if they will permit seafarers to go on galley.
Yeah. And our ex-senior master, Captain D.K. Mehta, can also answer this, probably, and then we'll give it to the panel.
Well, I don't know, I'm not aware of it that you're not supposed to go in the galley, but I'm sure I'd like to maintain a good relation with my crew and officers and give them good food. Yes, though she said that plate very dekh lena, but they are not there to see her plate. They are going to see their plate over there on the ship. So for that matter, I think the best thing is if you know the cooking. Actually, I'm talking the whole, that basically it boils down to the one person on board, and that is the master of the ship. Everything boils down to the master ultimately. If you are good to carry along with your crew and officers as family, then you will not have any problem. At least I never had any problem with the crew and officers. And yes, there was a cook who came on board, and the first day when he came, the Filipino, he made some spinach. So when he brought it on the table, I asked him one question: do you want to stay on board or do you want to go home? He said, no sir, I got a ship after 9 months, I want to stay on board. I said, if you want to stay on board, you better learn the cooking. He said, this is how we make. I said, all right, keep it ready in the evening, same spinach, I will come and prepare for you, show you how to do it, how to make paratha, how to make biryani, everything I show them how to make it. And I see him, after 2-3 ships, he's still there in Anakam. And that is how you have to carry yourself. If you know the cooking, you can teach. And if you don't know the cooking, sorry, then you can't teach.
So then,
I can't boil an egg, he wants me to make paratha. Not a chance.
I carry food.
Just to respond to one of the questions that you pointed raised, jokes aside, several companies are now following strict hygiene, strict dietary controls. Their chief cooks are being trained in setting menus that meet a balanced diet vis-a-vis the calorie and the hydrocarbons or whatever you want. So they are being guided on this to give a variety of the menu. They are also being guided to look at religious, respect religious sentiments, also vegetarians, non-vegetarians, gluten, etc. So there are these companies that are doing it today. By and large, most of the major operators are following such a regime.
Absolutely right, sir.
So, thank you, Dr. Tanan. In continuation to what he's saying, I think I'll just put it here that you as shipping companies are doing so much to create a name, to look at the well-being of your staff and your seafarers. And I think your success lies in their wellness. So, while you're also providing all the foods on the ship, a little bit of training, a little bit of help, a little bit of understanding, and making small adjustments could make life even better, because certain allergies and intolerances are not just a whammy, it's a fact. And if the seafarer is truly intolerant, and if the chef can just juggle a few things to make it better, well, it would get us kudos from the seafarer and take the name forward, right? So why not? I mean, there is scope for betterment, and we're all here looking for ways and means to make it better. So I think in that spirit, we can definitely look for scope for improvement in the nutritional part of seafarer foods.
Yeah, thank you. Captain Shantanu from Pacific Basin. I was listening to Anshul regarding the cases on board, and we also have several such incidents. A cadet hanged himself in the engine room. Very unfortunate Filipino guy. To be very precise, another guy on one of our ships, he committed suicide on Instagram live. By the time the girl, his girlfriend, is a Chinese guy, she could do something, she could call up the agency and they could call up the master, it was over. So I feel, and we are going through it as Dr. Matthews rightly pointed out, the red flags are very important, and awareness of senior officers and the people around, if they are looking, if they are feeling that something is not right, now is the time to speak, rather than keeping it to themselves and is in a wo theek ho jayega. That attitude has to change, I feel. And there have been cases, we have been taking psychological advice from Seabird, even 3 cubes, and there have been tremendous improvement. We thank you for that. And there have been several incidents when we had to cordon off the areas, keep double watches, take him to motivate him, ask the families to speak and everything, whatever we could, bring him to the next port so that we could sign him off, and bring him back to India, treat him and so on. So in a nutshell, the basic thing is awareness, I feel, and we all should be participating in that, especially the top 4. If they are having some kind of, they will come to know, believe me, they are the persons who will come to know. And if they do, then we have at Pacific Basin, of course, we have a very strong process where what they know we must know, so they tell us and then we take the actions accordingly. Thank you so much.
Thanks, Captain Shantanu. Just you made a remark on Instagram. Do you feel that instant access to social media can be also a cause for such
Yes,
impulsive behavior?
I feel so. That is one of the reasons. It is the need of the industry. I am sure many people in this room, they are also not happy with so much of openness and WhatsApp courts being held, blaming this, that and whatever is going on. But that does contribute a lot to these types of, because previously people didn't know what was happening behind, they used to wait for letters and all, and now they know if their kid has not done a poop or something, so that's...
I think one of the big elephants in the room that's not been addressed is the access of internet and the misuse. I don't know whether it's a boon or a bane. If anybody starts saying curb internet access, the youngsters today will go up in arms, or how can you curb our basic rights, etc. But we hear more and more downside of social media than the good it is bringing about. So perhaps I don't know the answer is, but there should be some solution found to it, and how are we going to deal with it? Maybe the subject matter specialist can speak about it.
Adding on to what Sir has said, social media can sometimes act like addiction. Right? We have substance usage, substance addiction. You have addiction of social media as well, because it gives you a quick response to your system. You get increased high when you have increased number of followers. A quicker reply makes you feel important at that moment in time. So yes, impulsivity is there, but impulsivity is a symptom of so many other disorders. So a major disorder is hiding under the face of impulsivity, and social media is one axis or one outlet that the person is using to exhibit these kind of symptoms. So what is important? Yes, one, we have to educate people on adequate social media usage. The internet or social media itself, it does not cause direct impact on the person. It is one of the many contributing factors. So hygiene of digital usage, digital hygiene as we call it, is something that we all practice. I mean, if I were to take away all your phones at this moment and tell them you will not have it till the end of the conference, how many of you would fidget? Pure of us, right? Fidget, like be fidgety, nervously, or Right, so a lot of us would feel slightly uncomfortable, not understanding what lands on the phone. And we expect seafarers to work with 1 GB data for an entire month or 2 GB data, where for them, honestly, we can sit in AC rooms and talk about that we have to do yoga, we have to practice diet, all of that. But in reality, and this is my perspective, when I speak to seafarers, they say, ma'am, I don't have time for all this. After a hard day of work, I want to come back to my cabin, sit, speak to my family and sleep. And that's the best relaxation I can get. And I need to have a good plate of food. This is my major relaxation, and they have been used to it for a longer period of time. If I want to introduce alternative relaxation methods and alternative lifestyle, it has to start slowly and steadily, and it has to be continuous. We can't give them random pieces of information, expect them to follow it and be all great on well-being. So well-being is a journey, it's a process, and it has to start slow.
Thanks, Divya. We are coming to the end of our time. We have only 2 minutes left. So what about the convener, Captain Chadha, can we allow some more time or no? So just have 2 questions, final 2 questions.
Okay. Sir, coming back to, I have something to say regarding Shantanu.
No questions.
Coming back to Shantanu. Sir, early detection, I would say, going through so many cases, early detection of mental illness is the key to treat the patient. So what we are doing, maybe as an industry we can do, what we are doing, we have tied up with the company, what I think he must be doing. We train our seafarers, we call them ambassador, wellness ambassador, to detect early signs of their colleague on board if somebody is going through mental illness. So if they can detect early, we can treat the patient early. So that's the key. Not only they can detect the case early, they are the first responders to any such situation. So as you said, top 4, we start with top 4, but we are training our junior officers also to become ambassador to wellness, so that they can detect, they can.
Captain Kamal, there are 2 people who have been raising their hands for the last 5 minutes. Can we allow? Okay. Yes, please.
A lot of CM changes have taken place in the PME program.
Our friends, I just got a call from the hotel. They want to know whether the dinner is to be converted to breakfast for tomorrow. I told them, wait, there are people here who might be having breakfast also.
CM changes have taken place in the PME program. And all the companies which have, when we approach them, we tell them that these are the psychological tests which should be done on each and every candidate. Because some of the candidates which we have found, those who have joined as a cadet, has a suicidal tendency. So we have earmarked it to the PF16 MMPI ROR, which gives you the identity that personality, the behavior of a person, of your seafarer, or has he got suicidal tendency or any other tendency which he has got. Okay.
You want me to answer whether these will identify?
No, this what we are doing now for the testing of all the cadets, seafarers, when they are joining any company. Now, any other highlighting you want to do it on that?
No, so firstly 16PF is not a valid test to identify pathology. MMPI R1 does identify pathology. Again, having said that, like I said, there needs to be a rigorous clinical examination done by an expert psychologist along with background history to give you accurate data. Again, having said that, psychological tests are not 100% foolproof. It is possible right now, under these circumstances, the person is absolutely fine at this point in time. When he goes on board, under certain circumstances, under certain challenges, there might be changes, and that could be emotional distress. Now, under a state of emotional distress, how does the crew respond to that person, and the shore person will respond to that person? Are we putting additional pressures? That emotional distress can escalate to self-harm tendencies, not necessarily suicidal. So there's a difference between self-harm and outright suicide, wanting to die. But if my expression of emotion is via self-harm, that is dangerous to the person, or even acts of sabotage for other people, and it is dangerous to the crew. So it's not 100%, there needs to be a process like put in place that you do assessments pre-joining, you follow up, you assign. So we generally have for young cadets, we have a buddy system assigned that one of the crew members monitors the person and gives us feedback. So my junior psychologist actually is in touch with the cadet, with the person who he is connecting, and they don't talk about technical stuff. They talk about adjustment issues, family issues, relationship, other thing except work. So there's a connect that is formed with the young person. We have to understand the generation that is coming in are quite vulnerable, are not as resilient because of the way they have been brought up, the upbringing, the lower amount of frustration tolerance that we see in the young
No, when you talk about the psychological, which are the places where you tell the companies that this person is not suitable as a prison worker?
When there is outright illness, psychosis, then not suitable. Absolutely not recommended. When there are milder issues or personality issues, we inform that these are certain personality characteristics which may trigger a specific kind of a mental health concern. Then we keep them under monitoring, and it has to be monitored. Outright a major issue like severe depressive episode or severe psychosis, or he has a history of mental health issues in the family. A previous suicidal incident has happened before with him or in the family. The immediate relative has had a mental health concern. The mother is suffering from schizophrenia. There is a 50% chance he may also get a later stage if there is a triggering episode.
No, these states which are there, ROR and all, will it establish that these people have got suicidal tendency?
Sir, we can continue this discussion afterwards, because I cannot say no to Captain Girish Pandit. He is our guest of honor, and he is very chairman of the committee. Yes.
Just on a lighter note, when we're talking about internet connections and the pros and cons of having on board, come January 2024, we have taken a decision that the internet will be put off on board between 17 and 1900, 12 and 1300, and morning 7:30 and 8:30. So these are the times we are blocking the internet off. खाने का टाइम है, खाना खाओ, मिलो सबको. People don't have time, because that's the feedback we got, that they did not even have time to interact with other people on board, and that was one of the major issues that is coming up. Oh, minute you're off, you're into your cabin, onto your systems, so you shut off the system. So I don't know what the effect is going to be, but that's the way we are trying to.
Let us know after 6 months.
We shall let you know.
Okay, I think we'll have to.
The food consumption went up.
Captain Chadha, I think.
One question from me.
Okay, please.
See, I have a question to Ms. Divya. See, now we are conducting psychometry, psychological, all these tests. Can we not eliminate the people who don't have the fire in the belly to be seafarers? First thing. Second, I want to know whether suicide rates are more in seafarers. What is the rate comparison with shore workers or shore employees? Now, like I am reminded of Kapil Dev. हमारा जमाने में तो हम 18 महीना 15 महीना सेविंग करता था, and we used to enjoy it. We never want to go home also. ऐसा भी था जमाना. But अभी कपिल देव बोलता है, ये stress this क्या है? Passion. It is all passion. Why can't we get people like that at sea? Stress this छोड़ो, जो what you like, there should be no stress. It is passion. I played with passion. I became a legend. Why not like that? What can we do to achieve that?
Well, nowadays passion is money. Most of them come for seafaring for money, and that's what I hear from my cadets. क्यों आना है seafaring में? पैसा मिलता है. Which is true and which is valid. Correct, but the need of the hour is changed from interest and passion to luxury, right? So there's a generational shifts in interest and ideas. We can't outright weed out people who have mental health issues, because unless and until it is right now in presenting condition in front of me, later on it may or may not happen, and that's unfair to a human being that I'm depriving him of his job and labor on the assumption that it may happen later on, and that's not fair, right? if in front of me he is presenting symptoms, then I have absolute authority to say this is not going to benefit you. You may lose your life. Why don't we do something a little more safer for your health and for your family? So that's how we explain that this is in good for you and your family. But to give a 100% guarantee, I don't think none of us can play God over here. Although we like to be, but we can't. So we cannot do that to anyone.
Just to add on, before implementing or before giving any psychometric test to the seafarer, we have to educate him about the importance of going this test, because nowadays what seamen is doing, they are faking up the responses or they are copying the responses of the fellow colleague. So there is no point in performing such psychological test. So we have to educate him about the importance of doing or giving test honestly. So that is must. And second thing, we have to be very non-judgmental and caring attitude we have to show. We have to tell them that we are there to help you out. So, and objective data also we are missing. We are not taking history from the family member about the seaman's past history. What he has suffered, whether he has taken any medications, whether he has suffered any mental illness or not. So objective data has to be considered in a psychological this thing.
Thank you, each and every one of the panelists. Very thankful to you for your deep insights into this particular panel discussion. Thank you very much to this wonderful audience who has been patiently listening at 10 minutes to 9 also. Thank you.
Requesting the panelists and the moderators to please wait back, and I also request Dr. Dipti Mankar to join us on stage. Please. I request Captain D.K. Mehta, one of the senior most mariners here, to present a small token of our appreciation to our esteemed panelists. Captain Mehta, can we have you on stage? Sonia Ajmera. Dr. Vinesh Chandramania. Captain Rajesh Tandon. Captain Anshul Rajvanshi. Ms. Divya Nair. Dr. Jacob Matthew. Dr. Dipti Mankar. And the captain of our ship, our moderator, Captain Mohan Nair. Please, sir. Requesting all panelists and moderators to kindly assemble for a group photo, please.